Hi. You must be Mark Adams. That's good. I've been anxious to meet you. Could I talk to you for a minute? My name is Peggy Turner, and I'm going to be with you tomorrow when you... Oh, Mark, what's wrong?
I want to keep my tonsils.
Oh, I know you're probably a little scared, and that's because you don't know what's going to happen tomorrow. But if you'll let me, I'll tell you all about it and why there's nothing to be afraid of. Okay?
Okay.
I'm your friend. And if there's one thing friends don't do, it's tell another friend things that aren't true, right?
Right.
Okay. Well, first of all, one of the other nurses is going to come in and take you downstairs early in the morning, and I'll be waiting there for you.
Can my mom and pop come too?
No. They're going to wait here. They'll want to be here when you come back to your room. Oh, you can take your friend with you, though.
You mean Pooh Bear?
Mm-hmm. Then when we go downstairs, I'm going to ask you to breathe very deeply into this. Want to try it? Just like an astronaut.
How will it feel?
Oh, it won't feel like anything, except breathing, just like you're doing now.
Oh.
The only difference is that when you breathe into this, before you can count very far, you'll be starting to dream. Maybe that you're an astronaut flying in space. And while you're dreaming about spaceships, your doctor is going to make sure that your tonsils will never bother you again.
Yeah?
Yeah. Then, when you wake up, I'll be right there with you. And I'll take you into the recovery room, or you'll sleep a little bit longer before you come back up to your room.
Will Mom and Pop will be waiting there for me and Pooh Bear?
That's right. So, if it's okay with you, I'll see you in the morning, okay?
Okay.
Good.
Peggy?
Yes?
Are you a nurse?
I'm a different kind of nurse, Mark. I'm a nurse anesthetist.
For almost as long as anesthetic agents have been used, nurses have been trained to administer them. The nurse anesthetist has been recognized as a trained specialist since the turn of the century. And that makes it one of the oldest specialty professions within nursing.
Dr. Jane Klein, Dr. Chris Rowland.
Today, some 50% of all anesthesia given in this country is administered by nurse anesthetists. And the majority of these specialists are members of the National Professional Association, the American Association of Nurse Anesthetists.
Miss French?
The simple operating room of yesterday has been replaced by the modern surgical suite. New anesthetic agents and new techniques are available, along with new instruments for monitoring the patient's condition. And these advances have brought about a change in the nurse anesthetist education.
Type of surgery being done.
Any graduate registered nurse may apply for training to become an anesthetist, but the competition is stiff. Only 1 out of 50 applicants is accepted, and those accepted must pursue a rigorous 2-year postgraduate program. A program that takes the nurse anesthetist through many hours of classroom instruction in areas such as anatomy, physiology, chemistry, physics, and pharmacology. In addition, the student receives at least 2/3 of his or her training in clinical instruction and works with hundreds of clinical cases, which include a minimum number in eye, ear, nose, and throat, respiratory care, neurosurgery, pediatrics, obstetrics, open heart, and even kidney replacement in cancer cases.
She's going to require assisted ventilation for several more days to maybe...
Upon completion of the approved educational program, the student is eligible to take the National Certification Exam, which takes an in-depth approach to testing the student's knowledge in all phases of the practice of anesthesia. The examination was developed by the American Association of Nurse Anesthetists, together with the Council on Certification. The examination questions cover anatomy and physiology as they apply to anesthesia. chemistry, and physics, and the principles and techniques of administering anesthetic agents. The qualifying examination for certification is administered yearly in testing centers throughout the country. The applicants must be registered professional nurses who hold a current valid state license. They must be graduates of a school of anesthesia, approved by the Council on Accreditation of Educational Programs, affiliated with the American Association of Nurse Anesthetists. Successful completion of this examination is the final step in becoming initially certified as a nurse anesthetist and an automatic member of the AANA. But the nurse anesthetist education doesn't stop there. The practice of anesthesia is not static. New agents and new techniques are constantly being introduced. And as the profession expands its scope, so does the nurse anesthetist.
Tell me how the fail-to cycle affects the pulmonary changes when you're dealing with IMV or you're dealing with controlled ventilation.
Okay, the fail-to cycle will activate in...
New product demonstrations are only one small part of the annual meetings sponsored by the American Association of Nurse Anesthetists.
So that's one of the reasons why I came to meet the officers and the candidates that were proposing to be the new officers. And also there were 4 important issues I wanted to hear the different sides on and to vote on this time.
Oh yes, I specialize in obstetrical anesthesia, so I'm here to attend the clinical sessions. We have some excellent speakers here for OB.
I've been coming to the annual meeting for the last 10, 12 years.
Mainly because I'm the sole practitioner, I don't have this chance to meet and talk and discuss clinical applications with other anesthetists every day.
And these annual meetings are only one of the activities sponsored by the association. For example, the AANA publishes a professional clinical journal that is highly recognized in its field.
As the decade of the 80s approaches, a number of important issues face us in nursing which have implication for nurse anesthesia.
The AANA is the professional voice of the nurse anesthetist, and it's an organization whose voice is well respected throughout the profession and throughout the entire healthcare field.
To these young people and hundreds like them throughout our country, we pledge the endeavors of the AANA. As a group, we will strive to maintain...
Recognizing the need for continuing education, the AANA has developed a continuing education program to help its members update their professional skills and enhance their professional competence. By attending workshops and annual meetings, or by taking other approved classes, the nurse anesthetist may earn continuing education credits.
In the operating room, where you're controlling the situation, and any time you anesthetize these patients, you're either assisting or controlling ventilation. That changes the picture.
40 continuing education credit hours must be earned every 2 years as a requirement of the Council on Recertification. And this recertification procedure ensures that the practicing nurse anesthetist will always keep abreast of developments within the field.
Would you please elaborate on the techniques used in your hospital to better psychologically prepare the pediatrics patient for surgery?
We bring the patient in to the hospital, usually on a Sunday afternoon, and give them a tour of the hospital. We let them have a good look at everywhere they're going to be. We meet a lot of the people that they're going to be seeing. They play with the toys. They get to know where the operating rooms are. They see what the anesthetic apparatus is. And we try and answer all the questions that they might have concerning their hospital visit and stay.
But now, let's look a little deeper at the profession itself.
Yes, 120/80, pulse 90.
Who are the nurse anesthetists? Where do they work? And what do they do? Currently, more than 15,000 women and men are actively practicing certified registered nurse anesthetists. And most of these CRNA practitioners are employed by single hospitals or large medical centers. Some participate in group practices. Some contract their services to networks of smaller hospitals and clinics, while still others are found in all branches of the military and other governmental facilities. Working under the direct supervision of an appropriately licensed physician or dentist, The nurse anesthetist may be called upon to administer anesthetic agents before and during surgery, to assist in the management and resuscitation of critically ill patients in coronary or intensive care units, or in the emergency room. They may also work in the obstetric department, pediatrics, or in respiratory care. But wherever they work, the CRNA is guided by standards established by the Council on Practice and the American Association of Nurse Anesthetists. They are nurses who enjoy their responsible role, nurses who are making a difference to their patients. The nurse anesthetist, a different kind of nurse.
Well, it's a perfect combination, nursing and anesthesia.
Oh, it's a continuously changing field. It changes from day to day.
Well, I think money was one factor, but now it means a whole lot more.
And when I found out I could specialize, I wanted to be a nurse anesthetist.
The nurse anesthetist, a very different kind of nurse, a special kind of nurse who's making a difference. The American Association of Nurse Anesthetists is proud to have introduced you to the nurse anesthetist, and proud also to be the professional voice of this vital profession.